What if the most dangerous blood pressure number isn't the highest one you've ever seen, but the one you've learned to ignore? Every day, millions of adults over 60 glance at a blood pressure reading, shrug their shoulders, and say, "That's normal for my age." But what if that belief is silently putting your brain, your heart, and even your independence at risk? The truth is, blood pressure doesn't suddenly become harmless because you grow older. In fact, after 60, the line between acceptable and dangerous becomes more important than ever. Today, we're going to uncover the real danger zone according to modern cardiology, understand why the numbers matter differently as we age, and learn how to protect the organs that keep us alive before the body starts sending warnings that can never be taken back. For many years, people have repeated the same comforting phrase, "A little high blood pressure is normal when you get older." It sounds reasonable because aging changes every part of the body. Hair turns gray, muscles become weaker, joints become stiffer, and eyesight often becomes less sharp. So it feels natural to assume that blood pressure should also rise with age. But modern medical research has shown that this belief can be misleading. Growing older does not suddenly make high blood pressure safe. Instead, it often makes the body more vulnerable to the damage that high blood pressure can cause. Before understanding what is considered too high, it helps to understand what these numbers actually represent. When your doctor measures your blood pressure, you see two numbers. The first, called the systolic pressure, measures the force created when your heart contracts and pushes blood through your arteries. The second, called the diastolic pressure, measures the pressure inside the arteries while the heart relaxes between beats. Together, these numbers tell an important story about how hard your heart is working and how much stress your blood vessels are carrying every second of the day. Think of your blood vessels as an intricate network of flexible highways delivering oxygen and nutrients to every cell in your body. When these highways are healthy, blood moves smoothly with little resistance. But over many decades, natural aging, unhealthy eating habits, smoking, diabetes, lack of physical activity, and chronic stress can gradually change the structure of these blood vessels. They lose some of their natural flexibility and become stiffer. As a result, the heart must generate greater pressure to move blood throughout the body. Many older adults mistakenly believe that because arteries become stiffer with age, high blood pressure should simply be accepted as part of growing older. In reality, stiff arteries explain why blood pressure often rises, but they do not make that rise harmless. Imagine driving a car with worn-out tires. The worn tires explain why the ride becomes rougher, but they do not make driving at high speed any safer. In much the same way, aging explains why blood pressure may increase, yet the increased pressure still places extra strain on delicate organs that have been working faithfully for decades. One of the most surprising facts about high blood pressure is that it usually causes no pain. A person may wake up feeling energetic, enjoy breakfast, spend time with family, and complete normal daily activities while blood pressure quietly remains far above a healthy level. There may be no headache, no dizziness, and no obvious warning that the heart, brain, kidneys, and eyes are being exposed to constant stress. This is why high blood pressure has often been described as a silent condition. Its damage happens gradually, accumulating day after day, year after year, until the body eventually reaches a point where the effects become impossible to ignore. Another common misunderstanding is focusing on a single reading instead of recognizing long-term patterns. Blood pressure naturally changes throughout the day. It can rise during exercise, emotional excitement, pain, or even after drinking coffee. A single elevated measurement does not automatically mean someone has chronic hypertension. Likewise, one normal reading does not guarantee that blood pressure remains healthy all the time. Doctors usually look at repeated measurements taken over several days or weeks because these patterns provide a much clearer picture of cardiovascular health. As people pass the age of 60, paying attention to blood pressure becomes increasingly important because the organs themselves have become more sensitive after decades of continuous work. The heart has pumped billions of times. The kidneys have filtered enormous amounts of blood. The brain has depended on a steady flow of oxygen every moment of life. Even small increases in blood pressure over many years can gradually wear down these remarkable systems. This is why modern cardiology encourages older adults not to dismiss elevated readings as an unavoidable part of aging, but to view them as valuable information that allows action before silent damage becomes lasting. One of the greatest dangers of high blood pressure is not how loudly it announces itself, but how quietly it works. Many serious diseases begin with pain or obvious discomfort, giving the body a chance to ask for help. High blood pressure often does the opposite. It can remain hidden for years while slowly affecting nearly every major organ. A person may feel perfectly healthy, continue working, enjoying family gatherings, taking walks, and sleeping well, all while invisible damage is taking place inside the body. This silent nature is exactly what makes uncontrolled blood pressure so dangerous after the age of 60. Many people ask the same question: how high is too high? While individual blood pressure goals should always be determined by a healthcare professional based on a person's overall health, consistently elevated readings, especially those around or above 140/90 mmHg, generally deserve medical attention. Readings that reach 180/120 mmHg or higher require immediate medical evaluation because they may represent a medical emergency, particularly if accompanied by symptoms such as chest pain, severe headache, confusion, weakness, vision changes, or difficulty breathing. The danger is not simply the number itself, but the amount of stress that repeated high pressure places on the body's delicate tissues over time. Imagine turning a garden hose to its highest setting and leaving it there every day. At first, the hose appears strong enough to handle the pressure. Weeks pass, then months, and eventually tiny areas begin to weaken. The material stretches, small cracks appear, and the hose becomes more likely to leak or burst. Blood vessels respond in a similar way. They are designed to carry blood efficiently, but they are not meant to withstand excessive pressure day after day for years. Constant force gradually injures the inner lining of the arteries, making them less healthy and more vulnerable to disease. The heart is usually the first organ forced to adapt. Every heartbeat must push against higher resistance, almost like trying to lift a heavier weight over and over again. At first, the heart muscle becomes thicker in an attempt to keep up with the extra workload. This may sound like a sign of strength, but over time it becomes a disadvantage. A thickened heart muscle becomes less flexible and requires more oxygen to function properly. Eventually, the heart may struggle to pump blood efficiently, increasing the risk of heart failure, irregular heart rhythms, and other cardiovascular problems. The brain is another organ that depends on stable blood pressure every second of every day. Billions of nerve cells require a constant supply of oxygen and nutrients. When blood pressure remains too high for many years, the small arteries deep within the brain can become damaged. Some narrow gradually, reducing blood flow, while others become fragile and more likely to rupture. This increases the risk of stroke, but the effects are not always sudden. Tiny injuries can accumulate over time, affecting memory, concentration, decision-making, and overall cognitive function. A person may simply believe they are experiencing normal aging, when in reality years of uncontrolled blood pressure have contributed to the changes. The kidneys also face enormous pressure because they continuously filter waste from the bloodstream through millions of tiny blood vessels. These delicate filters depend on healthy circulation to perform their job. When blood pressure remains elevated, the small vessels inside the kidneys gradually become scarred and less effective. As kidney function declines, the body has greater difficulty regulating fluid and salt balance, which can further increase blood pressure. A harmful cycle begins, where high blood pressure damages the kidneys, and damaged kidneys make blood pressure even harder to control. Even the eyes can reveal the hidden effects of hypertension. The retina, located at the back of the eye, contains an intricate network of extremely small blood vessels. Persistent high blood pressure can narrow, weaken, or damage these vessels, reducing blood flow to the sensitive tissues responsible for vision. Over time, this may contribute to blurred vision or permanent vision loss in severe cases, often without causing noticeable symptoms until significant damage has already occurred. Perhaps the most important lesson is that the real danger zone is not defined only by a single frightening reading on one particular day. It is defined by allowing elevated blood pressure to continue month after month and year after year without understanding what it is doing inside the body. Every healthy reading maintained through proper medical care and healthy daily habits represents another opportunity to protect the heart, preserve the brain, support the kidneys, and maintain the independence and quality of life that become increasingly valuable with each passing year. As we grow older, the body changes in ways that are both remarkable and inevitable. Every heartbeat, every breath, and every step leave a small mark on the tissues that have faithfully supported us throughout life. The cardiovascular system is no exception. After the age of 60, many people notice that their blood pressure readings are not the same as they were in their 40s or 50s. This often leads to confusion and an important question: if blood pressure naturally rises with age, should we simply accept it? The answer is more thoughtful than a simple yes or no, because aging changes the body. but it does not remove the importance of maintaining healthy circulation. One of the biggest reasons blood pressure changes with age is that the arteries gradually lose some of their natural flexibility. When we are young, healthy arteries expand easily each time the heart pumps blood. They act almost like soft elastic tubes, gently absorbing the force of every heartbeat before returning to their normal shape. This flexibility helps keep blood flowing smoothly throughout the body while reducing stress on the heart. Over many decades, however, the artery walls slowly become thicker and stiffer. Natural aging plays a role, but so do years of exposure to high cholesterol, smoking, diabetes, chronic inflammation, unhealthy eating habits, and lack of physical activity. Calcium and fatty deposits may also build up within the artery walls, making them less able to stretch. When the arteries become rigid, every heartbeat creates a greater surge of pressure because the blood vessels cannot absorb the force as effectively as they once did. This is one reason why the upper blood pressure number, known as systolic pressure, often rises in older adults. Many people mistakenly believe this increase means nothing needs to be done. In reality, the body is simply revealing that the cardiovascular system has become less flexible over time. It is similar to walking on an old wooden bridge. The bridge may still carry people safely, but it requires more care and attention than it did when it was newly built. Ignoring signs of wear does not strengthen the bridge. In the same way, ignoring rising blood pressure does not protect aging arteries from further damage. Another important fact is that the lower blood pressure number, called diastolic pressure, does not always rise along with the systolic number. In some older adults, it may remain stable or even decrease while the systolic pressure continues climbing. This creates a condition known as isolated systolic hypertension, which becomes increasingly common after the age of 60. Because many people focus only on the lower number, they may overlook a high systolic reading, believing everything is fine. Modern cardiology recognizes that elevated systolic pressure alone can significantly increase the risk of heart disease, stroke, and other complications, even when the lower number appears normal. At the same time, blood pressure that becomes too low can also create problems, especially in older adults. Many people assume that lower is always better, but the body depends on adequate blood flow to deliver oxygen and nutrients to every organ. If blood pressure falls too much, the brain may not receive enough blood during sudden movements such as standing up from a chair or getting out of bed. This can lead to dizziness, lightheadedness, blurred vision, weakness, or even fainting. A simple fall caused by low blood pressure can result in broken bones, head injuries, or a loss of confidence that limits independence for months. Very low blood pressure may also reduce blood flow to vital organs if it persists, particularly in individuals with existing heart disease or other medical conditions. This is why doctors usually avoid treating blood pressure with a one-size-fits-all approach. The goal is not to push every reading as low as possible, but to find a healthy balance where the heart, brain, kidneys, and other organs receive the circulation they need without exposing blood vessels to excessive pressure. This balance becomes even more important because every older adult is different. A healthy and active 60-year-old who exercises regularly may have very different blood pressure goals from an 85-year-old living with diabetes, kidney disease, or previous heart problems. Medications, hydration, physical fitness, and overall health all influence what is considered the safest range. Rather than chasing a perfect number, modern cardiovascular care focuses on protecting the whole person, preserving mobility, supporting clear thinking, reducing the risk of stroke and heart disease, and helping people enjoy more healthy years with strength, confidence, and independence. One of the most surprising things about high blood pressure is that the body often whispers long before it ever shouts. Many people wait for a dramatic warning sign before taking action. They expect severe pain, obvious illness, or a symptom that makes the problem impossible to ignore. But high blood pressure rarely follows that pattern. It often develops quietly over many years, allowing damage to build little by little while daily life continues as usual. This is why paying attention to small changes and everyday habits becomes one of the most powerful ways to protect long-term health after the age of 60. Some people with very high blood pressure experience headaches, blurred vision, nosebleeds, shortness of breath, chest discomfort, or unusual fatigue. However, these symptoms are not reliable indicators. Many older adults have dangerously high blood pressure without experiencing any noticeable warning signs at all. They may feel energetic, sleep well, and continue their normal routines while their heart and blood vessels are under constant strain. Waiting until symptoms appear often means the condition has already been affecting the body for a long time. Sometimes the warning signs are much more subtle. A person may notice becoming unusually tired after activities that once felt easy. They may feel slightly dizzy when climbing stairs or standing up quickly. They may find themselves becoming short of breath during a routine walk or feeling an unusual heaviness in the chest after mild physical activity. Although these symptoms can have many possible causes, they should never be dismissed as just getting older. They deserve thoughtful medical evaluation because they may reflect changes in the heart, circulation, or other important systems. While genetics and aging influence blood pressure, many everyday habits quietly push those numbers higher without people realizing it. One of the biggest contributors is excessive sodium intake. Salt helps regulate fluid balance in the body, but consuming too much can cause the body to retain extra water. This increases the volume of blood flowing through the blood vessels, placing additional pressure on artery walls. Many people believe they do not eat much salt because they rarely use a salt shaker. Yet processed foods, canned soups, packaged snacks, fast food, sauces, and restaurant meals often contain surprisingly large amounts of hidden sodium. Physical inactivity is another common factor. The human heart is a muscle, and like every muscle, it performs better when it is used regularly. Gentle activities such as walking, swimming, cycling, or light strength exercises help improve circulation, maintain healthier blood vessels, and support overall cardiovascular function. Long periods of sitting, on the other hand, gradually reduce physical fitness, encourage weight gain, and make it more difficult for the body to regulate blood pressure effectively. Body weight also plays an important role. Carrying excess body fat means the heart must work harder to supply oxygen and nutrients throughout the body. Over time, this additional workload can contribute to rising blood pressure. Even modest weight loss, when recommended by a healthcare professional, has been shown to improve blood pressure in many individuals. The goal is not achieving perfection but making steady, sustainable improvements that reduce strain on the cardiovascular system. Stress is another influence that often receives less attention than it deserves. Daily worries, financial concerns, loneliness, caregiving responsibilities, and emotional challenges can activate the body's stress response. During stressful moments, hormones temporarily increase heart rate and blood pressure to prepare the body for action. Occasional stress is a normal part of life, but when stress becomes constant, unhealthy coping habits may follow, including overeating, poor sleep, smoking, or excessive alcohol consumption, all of which can further increase cardiovascular risk. Sleep itself is deeply connected to healthy blood pressure. During restful sleep, the heart and blood vessels receive an opportunity to recover from the demands of the day. Poor sleep quality, untreated sleep apnea, or consistently sleeping too little may keep blood pressure elevated for longer periods. Many older adults assume interrupted sleep is simply part of aging. Yet improving sleep habits or treating underlying sleep disorders can become an important part of blood pressure management. Healthy eating patterns provide another powerful tool. Meals rich in vegetables, fruits, whole grains, beans, nuts, lean proteins, and healthy fats provide nutrients that support blood vessel health and overall circulation. Drinking enough water, avoiding tobacco, limiting alcohol when appropriate, staying physically active, managing stress, taking prescribed medications consistently, and attending regular medical checkups all work together like small pieces of a larger puzzle. None of these habits creates perfect health overnight, but together they gradually strengthen the body's ability to maintain healthier blood pressure and reduce the silent strain placed on the heart, brain, kidneys, and blood vessels with every passing day. Knowing your blood pressure is one thing, but knowing how to measure it correctly is something entirely different. A single number written on a piece of paper never tells the whole story. Blood pressure is constantly changing throughout the day. It rises when you climb stairs, exercise, become excited, or feel anxious. It often falls while you are resting or sleeping. Because of these natural changes, one reading should never become the basis for fear or false reassurance. The real value comes from observing consistent patterns over time and sharing those patterns with your healthcare provider. Many people unknowingly make small mistakes when checking their blood pressure at home. They may measure it immediately after walking, drinking coffee, smoking, or rushing around the house. Some cross their legs, talk during the measurement, or hold their arm in an uncomfortable position. These simple habits can affect the result. For a more accurate reading, it is generally recommended to sit quietly for several minutes beforehand. Keep both feet flat on the floor. Rest the arm at heart level. Avoid talking during the measurement, and use a properly fitting blood pressure cuff. Taking two readings about 1 minute apart and recording the results can provide a clearer picture than relying on a single measurement. Keeping a blood pressure diary is one of the most useful habits older adults can develop. Recording the date, time, and readings each day allows both you and your doctor to identify important trends. Sometimes blood pressure is higher only in the doctor's office because of nervousness, a phenomenon often called white coat hypertension. Others may have normal readings during clinic visits but elevated blood pressure at home. Regular home monitoring helps uncover these patterns and supports better treatment decisions. Many people ask what blood pressure they should aim for after the age of 60. The answer is not exactly the same for everyone. In general, many cardiologists aim for a blood pressure below 130/80 mmHg in healthy older adults who can safely tolerate treatment, while recognizing that targets may be adjusted based on overall health, frailty, existing medical conditions, and the risk of side effects. The goal is not to achieve the lowest possible number but to reduce the long-term risk of heart attack, stroke, kidney disease, and other complications while maintaining good quality of life. Just as important as knowing your target is recognizing when medical attention should not be delayed. If repeated readings remain consistently elevated despite healthy lifestyle changes or prescribed medication, it is important to schedule an appointment with your healthcare provider. Medication adjustments, additional testing, or evaluation for underlying conditions may be necessary. However, if blood pressure reaches 180/120 mmHg or higher, especially when accompanied by symptoms such as severe chest pain, sudden weakness, confusion, difficulty speaking, severe headache, vision changes, or shortness of breath, emergency medical care should be sought immediately because these signs may indicate a life-threatening condition. Some older adults become discouraged when they are prescribed blood pressure medication. They see it as a sign that their body has failed or that they have somehow done something wrong. In reality, medication is often another tool to help protect the heart and blood vessels that have worked faithfully for decades. Lifestyle improvements remain incredibly important, but in many cases they work best alongside properly prescribed medication rather than replacing it. Taking medicine consistently, exactly as directed, gives it the best opportunity to reduce long-term damage. It is equally important never to stop blood pressure medication suddenly without consulting a healthcare professional. Some medications require gradual adjustment, and stopping them abruptly can cause blood pressure to rise quickly, increasing the risk of serious complications. Even when home readings improve, those healthy numbers may be the result of the treatment itself rather than evidence the treatment is no longer needed. Perhaps the most reassuring message is that blood pressure management is not about chasing perfect numbers or living in constant fear of every reading. It is about understanding your own body, working closely with your healthcare team, and making informed decisions that protect your future. Every healthy meal, every walk around the neighborhood, every properly taken medication, every restful night's sleep, and every carefully recorded blood pressure reading becomes another investment in preserving your heart, protecting your brain, maintaining your independence, and giving yourself the greatest opportunity to enjoy the years ahead with strength, confidence, and peace of mind. This content is intended for educational and informational purposes only and should not be considered medical advice, diagnosis, or treatment. Blood pressure targets vary based on your age, overall health, medications, and existing medical conditions. Always consult your physician or a qualified healthcare professional before making changes to your medications, diet, exercise routine, or blood pressure management plan. If you experience symptoms such as severe chest pain, sudden weakness, difficulty speaking, vision changes, or severe shortness of breath, seek emergency medical care immediately.